Good morning, everyone. Dr. Zac Morgan here, division lead with the spine division here with ICE Physio, bringing you all an episode on this Clinical Tuesday this morning on reps with reflection. This episode is kind of near and dear to my heart because it's one of those things that I wish I had known early in my career, how to basically shorten the gap, how to, in my mind, this is your fastest shortcut for clinical expertise. And that comes with developing a reflective practice. Early in my career, and really still to this day, the constant advice you would get as a newer graduate, or even if you weren't a newer graduate, but perhaps you were someone who was changing from one section of our profession to another, the constant advice you get is that it just takes reps. And what you need to do is accumulate reps, and that's what will get you good. That's your key to expertise. And while in some ways I agree with this advice, I think the advice to just get your reps in isn't enough. Reps are important, but how you process those reps is the key for sure to clinical expertise. And so I want to spend a little bit of time this morning unpacking a few factors that I think you could immediately change in your practice that are going to help you develop reflective reps, and how those reflective reps in your clinical practice, really regardless of what section of our profession you're in, will really get you on that shortcut to expertise. So again, reps alone are not enough. Simply doing something multiple times will not make you an expert. You have to be reflective about it. So, the action I'm charging you with this morning is to start organizing these reps, and you're going to organize them for your clinical growth. If you've taken cervical or lumbar spine management here with ICE, you know that we preach in that course that the body chart's not helpful, it's essential. This is a part of the clinical exam that at ICE we believe you have to do if you're going to do a good job. And the reason we believe so strongly in the body chart is its power for developing your pattern recognition or hypothesis lists, if you will. The body chart's your ultimate tool to start recognizing what's going on with the person in front of you. But I think sometimes it gets lost that that's not simply something you're going to do the one time at the beginning of the plan of care and not revisit. This is something that we should really be compiling and organizing in our brains, and then actual in practically somehow, to where we can reference this material for future reference. One thing that's frustrating about our profession is our research is not that great. And so, in a lot of cases, the research won't guide you exactly what to do with your patients. So, it's really hard to read a bunch of randomized control trials and know what to actually do with your patients. What I suggest is do that, recognize what interventions are helpful. But on top of that, start developing what I'm going to call your clinical pattern recognition Bible. And that's going to be full of body charts from patients that you actually see. So when you build this database, for me, the easiest way is on the iPad. And the reason I think it's easier on the iPad, it's a little bit easier to erase and fix mistakes as you're going through it with the patients. But the big key is on the back end. If you've got these body charts stored in an app like Notability or any of the apps out there that do a good job storing notes, you can really reference those with ease. But it does not matter to me if you prefer paper. Go ahead and use paper and store them in a folder, but just make sure it's referenceable. You need to be able to get back to these body charts. But when you're unpacking with your patient their symptoms, and you're drawing on that body chart where they do and don't have symptoms, you're clearly marking where those are. You have to put a few things on the body chart to make sure this practice becomes useful. One, write your hypotheses down. So when you see where their symptoms are and aren't, write down a few things that you think might be driving those symptoms. Second, at the end of the exam, once you're finished with the physical exam, write down what confirmed or refuted your hypothesis within that physical exam. What did you look at that helped you make a decision on the treatment you chose for today? Make sure that's written on the body chart. Next, write down your treatment choice. What did you choose to do? And jot yourself a note as to why. The patient had a highly irritable cervical radiculopathy, so I chose to do manual traction. The patient had a low irritability cervical radiculopathy, so I chose to do overpressured retraction reps. Doesn't matter what you chose, but jot down what you did and why. Lastly, for day one, on the body chart, you're going to write down their in-session response. What changed? Did their ULTT improve? Was their ipsilateral rotation better? Did you see changes in the active range of motion somewhere? Does not matter what you saw, write it down. If it was worse, write it down. If it was unchanged, write it down. Put all of this on your day one body chart. And this is independent of the note that you're going to write up to get reimbursement or to document your session. This is for you. So you need to be able to get back to the body chart and be able to see those things. What did I think was going on? What were my hypotheses? What did I find in the physical exam? And then how did the patient respond to my trial treatment? The next key is a few sessions in. Once you really confirm and feel good about your hypothesis and the patient's moving forward, I want you to revisit the body chart. So pull it back out of the folder or pull it back up on your iPad and put some space on that note to where you can write how, after a few visits, how has it gone? Has their plan of care experienced a really steep trajectory? They've improved each time you've seen them. Did you hit a home run? Have they stalled out? Were they doing well and now they're stalled out? Are the symptoms unchanged? Be honest here. This is just for you. Be intellectually honest. What changed in their plan of care? What was the overall trajectory? Were they a rapid responder? Did the symptoms not change? All of that needs to be on there. So a few visits in to the plan of care, we revisit the body chart and we write these things. This data is going to be crucial for your future clinical decision making. Now we're moving into the self-reflection part. This practice that I'm describing to you all, building this body chart Bible, if you will, is what elevates your reps. One rep turns into exponential learning when you do it like this. Rather than having to get 10 reps or 15 reps or 20 reps with a pattern, you've now done the due diligence with a handful of reps to get expertise very, very quickly. So it really exponentially improves. This gets faster the more you reference it. So the beautiful thing about it is when you practice in this way that I'm describing and you revisit your body charts, the next time a patient comes in with a similar pattern of pain, maybe they have a cervical radiculopathy, or maybe you had a differential diagnosis between rotator cuff irritability and cervical radiculopathy. You picked one and you treated it first. You're going to be able to reference that body chart and see exactly what you did and why, what were their physical exam findings and how that changed. And it's going to help you make a handful of decisions. One, if this new patient who's presenting the same way the other one did, if this new patient has those same exact symptoms, you're either going to replicate it. If they did really well, do the same thing. For sure, go back to those things that worked. If they didn't do well, if they got worse, perhaps be less vigorous at the front end. If the patient's symptoms were unchanged altogether, maybe look at a neighboring region or an alternative hypothesis for that presentation. The beauty is that reflection and going back to that body chart. If it worked, replicate it. If it failed, change something. This is the way that you can become your own mentor. Mentorship matters. Getting with a clinician who you can learn from is huge, but you can do a lot on your end as well, even independent of having a formal mentorship. So intellectual honesty is key. While you're building this pattern recognition Bible, you have to be honest with yourself about how things went, how the patient responded. But as you do this and as you accumulate a few reps of any given pattern, your ability to spot it is going to exponentially grow. This practice is your fastest shortcut to clinical expertise. I believe that fully. So at the end of the day, getting reps is not enough. You do need to accumulate reps. Just simply getting comfortable in front of people is part of it, but it's reflective reps that change practice. The way you develop reflective reps is you create a clinical practice or a clinical pattern Bible. The way you do that is you organize your body charts. On the body charts, you write your hypotheses, you write what you found in the physical exam, you write your trial treatment and their response, and then you revisit it throughout the plan of care, giving yourself the indications of how that patient's trajectory through the plan of care went. And then you revisit that the next time you see a similar pattern. It's a simple process, but it takes discipline. It takes organization, and it's probably the one factor that's going to get you to expertise quicker than anything else. At the end of the day, team, it's not reps that makes you great. It's reflecting on your reps that make you great. So if you're new in the profession or you've just changed gears, don't let someone make you feel less than because you don't have a lot of reps. You may already have more reflective reps than people who have been doing it for years if you're organizing things this way. It's a quick one this morning, team, but I think it's a potent one. Start building that pattern recognition Bible, revisit it regularly throughout your plans of care, and I can guarantee you this is going to go well for you as you start gathering some expertise in the profession. If you're not familiar with how to do the body chart, or this seems a little bit intriguing to you, or even if it's been a while since you've taken it and you need a refresher, let me just point you in the direction of a few courses we have coming up. Cervical spine, March 22nd and 23rd, Portland, Oregon. Only a few seats left there. April 5th and 6th, we're in two spots for cervical. So Salt Lake City, Utah, and then Minneapolis, Minnesota. That one's almost sold out as well. So if you're looking for Portland or Minneapolis, move quick. Salt Lake City, seats left. So make sure you jump into any of those if you're looking to improve your pattern recognition in the cervical spine. If you're looking for lumbar spine, we've got Gretna, Louisiana. That's on April 12th and 13th. That same weekend, Highland, Michigan, and then also May 31st and June 1st in Burlington, New Jersey. So several good options here to jump into a spine course. You'll learn a ton about filling out that body chart and how to gather this information, how to build a nice, robust hypothesis list. But team, that's all I've got for you on this Clinical Tuesday. Let me know how this goes. It can start today with your clients that you're seeing later today. You can really start taking this shortcut to clinical expertise. Let me know how it goes. Love to chat with you all throughout the day as you have questions. That's all I got for you. Have a good Tuesday.